Hello, I'm David Kerr, Professor of Cancer Medicine from University of Oxford, and today I'd like to talk about the impact that the COVID pandemic is having and will have on cancer research. One of the great triumphs, I think, of our global cancer community is the degree of collaboration that we have in terms of trying to put as many of our patients as we can into clinical trials to answer whatever important question of the day. And I think this global approach has been imperiled by the pandemic. What do I mean by that? Well, if we consider the patient, the sponsor, the host organisation, the clinical chief investigator, the regulatory authorities, one thread that links all of those in this time is patient safety. So how can we maintain patient safety monitoring in the clinical trial at a time when many of us are locked down and at a time when patients are genuinely nervous about going to hospital and accessing conventional healthcare facilities? We know that from the sponsor's point of view, the host organisation may have difficulty in providing access to clinical facilities because of rerouting of patients who are COVID positive or COVID negative. Clinical staff have been redeployed. Our research nurses are now helping to support delivery of chemotherapy in the front line. Some of our junior doctors and fellows have been moved out of the cancer centre to work in the general wards looking after COVID patients. Access to diagnostic tools, scans, blood tests and so on are limited again because these have been reprioritised to support the tsunami of COVID patients that we're seeing within the hospital. So in a time of limited resource, we need to be able to adapt. One of the most important things that we've done in our trials office is to reassess the risk-benefit ratio for all our patients, thinking, is it safe for our patients to continue on trial, and if they were to pick up the virus, could this have calamitous additional effects? So that's the starting point. Having carried out the risk-benefit assessment, I guess there are three responses to that. One would be to suspend the trial completely, no further recruitment, and those patients who have been recruited to take them off the experimental treatment, just to suspend it. One would be to halt new recruitment, so keep patients who have already been added to the trial to watch over, to care for, to monitor, but no further recruitment. And the third, perhaps the most logical, is to adapt and amend how we monitor trials and how we maintain patient safety throughout. I guess the biggest element of that is using remote telemedicine, teleconferencing for following patients up, for ensuring safety, for capturing data remotely, for making sure that the data trails continue to be important for any trial. And there's no doubt that the regulatory authorities during this time have been flexible in allowing the possibility of remote rather than face-to-face consultations with patients, and using remote access to electronic health patient records. There's an important wrinkle with this though, because we must at all times maintain patient confidentiality. So if we are allowed, or if we are allowing our host organisation, monitors, CRAs, CROs, trial intermediaries to access patient data remotely, we must, I think, get implicit consent from patients so that they understand that their data is being looked at off-site remotely. And I think we must ensure that those who are reviewing the data fields necessary for clinical trial follow-up do so within an environment that maintains patient confidentiality. For example, you wouldn't want a trial monitor to be accessing potentially sensitive confidential information if they're living at home or in a busy, crowded environment in which other people might be able to view what they're doing, just looking over their shoulder. So the maintenance of confidentiality seems important too. Will anything good come from this crisis? Um, Difficult to say just now. The worrying side is that I think there will be a negative impact coming out of this on funding for cancer research and clinical trials. We are wonderfully well supported by government, by charity. Cancer Research UK is one of the largest charities in the world and having an enormously powerful vision for the future of cancer research. But their income has been hit hard by the coronavirus pandemic and the lockdown, and therefore it will impair for a period of time their ability to fund good science. I'm sure governments around the world will be shifting some of the focus of their research away from conventional disease areas to think about virology, coming up with better drugs, better vaccines, investing in healthcare systems, pandemic preparedness. I think all governments are going to have to re-examine how they responded in a timely fashion to this pandemic, and I'm sure that that will have consequences for us all. Potential upside, I think that remote patient care is here to stay. I run my Friday morning clinic sitting from the kitchen table, and I think I can do it safely, effectively, morally, and with I think emotional support. And if we can do that for conventional patient care, I think we can adapt that and transfer it to how we follow patients up in clinical trials. I think using mobile phone apps, collecting data on side effects, patient-reported outcome measures, I think that's here to stay and will make a real difference. We've been trying for years as a university employee to get full access on university computers to the patients that we care for within our National Healthcare Service. It's been an uphill battle, but with the COVID outbreak, we seem to have accomplished in 5 days what we couldn't have accomplished in 5 years. So there has been a momentum behind embracing digital health and embracing newer technologies for looking after patients. The politicians say, never let a good crisis go to waste, and so perhaps in that sense, we have moved our care of cancer patients forward. It's an interesting and difficult time for us all. We realise that there are many chat forums in which we're exploring all elements of COVID and all aspects of clinical care, but just thinking a little about cancer research and its importance to the community of patients that we serve. It has been impactful, but I think that through adaptation that we can come through this together and strong. As always, thanks for listening and the message that we all give. Keep well and stay safe. For the time being, Medscapers, over and out. Thanks for listening.